It's now my pleasure to introduce our next speaker. Dr. Noah Goldfarb is a dermatologist at the University of Minnesota and the Minneapolis VA healthcare system. Dr. Goldfarb's clinical interests include autoimmune skin diseases, hidradenitis suppurativa, which is a chronic and painful inflammatory skin condition, as well as complex dermatological health conditions. Dr. Goldfarb leads a clinic that is focused on treatment of hidradenitis suppurativa and autoimmune skin and joint diseases. Thanks so much for joining us today, Dr. Goldfarb.
Thank you so much for having me. I'm super excited to be here with you all talking about our microbiome transplant therapy for hidradenitis. Thank you for that kind introduction. I'm going to jump right in here. So I do clinical trials, all of these related to hidradenitis, and do some advisory work and consulting around those trials. I also do get research support from Novartis and Deepex Health. So after this talk, hopefully you'll be able to recognize some of the struggles faced by patients with HS and describe the roles of the microbiome in HS pathogenesis. So HS is a chronic, debilitating, painful, autoinflammatory skin condition characterized by painful inflammatory nodules, abscesses, and draining tunnels that usually affect what we call the intertriginous areas or the body folds, such as the armpits, under the chest, groin, under the abdomen, and the buttocks. Used to be thought to be a rare condition. Now we know has a global prevalence of 0.1 to 1%. And it's increased in women and persons with skin of color. It has a dramatic effect on people's quality of life. In terms of other skin conditions that we commonly think of, like psoriasis and eczema, it is much more destructive on people's quality of life. Has similar hospitalization rates compared to congestive heart failure, and uses very high costs of care. The care that happens for these patients is in high-cost care environments such as emergency rooms and inpatient care. And patients liken these flares to the roller coaster from hell, if you will. These patients face a lot of challenges. A lot of them have missed a lot of work. 10% have been fired and 23% have missed promotions. This was found in a global survey of patients on unmet needs for patients with HS. Many of them have a diagnostic delay of 7 to 10 years. And during that time, they've seen 5 clinicians for this with 17 visits. We see high rates of mental health conditions such as depression and anxiety, as well as completed suicides because of how devastating this condition is on quality of life. Currently, we have 2 FDA-approved drugs. The last one we just got approved was in last year in October, and the first one, adalimumab, was in 2014. Prior to that, we had nothing. So I would say in the last 10 years, we have had major strides in caring for patients from this condition. Unfortunately, these medications have about a 40 to 60% efficacy, which leaves about 40 to 50% of patients with no effective FDA-approved treatments. So we still have a ways to go for being able to care for these patients holistically. The other thing is these patients face significant barriers to care. Back in 2020, there was an important publication in the British Journal that asked leaders of several Facebook support groups about barriers to care for this patient population. These support groups on Facebook support over 60,000 patients with HS. And what we found was there were a lot of barriers, some of these being lack of knowledge on the part of clinicians in order to make the diagnosis, resulting in the 7 to 10 year diagnostic delay. Limited access to dermatologists, as well as those that are knowledgeable about the condition, and limited access to mental health care providers. And there was also we learned that there was a rampant distrust of the medical community within this patient population due to perceived lack of empathy. I can tell you from personal experience, as well as from this article, that a lot of patients have come from provider-patient relationships that have been harmful and hurtful, and where they've been either given the wrong diagnosis or blamed for their condition. So I have a little patient video to talk a little bit about the journey, and I'll only just play a few minutes of this. And here we go.
Hello, my name is Athena, and I'm a patient living with hidradenitis suppurativa, or HS for short. I'm here today to tell you about my life living with hidradenitis, the road I've taken to get here, and how this disease has impacted my life and an entire community that I spend my life advocating for. I could fill chapters with this journey, so let's get started. As of today, I'm happy to report that my HS is the best it's been in decades. I have a dedicated team that manages my surgical and medical needs and who is also available should I have an emergency. I currently take a biologic, I have quarterly Botox injections, and I have just a few more small surgeries to go. In total, I've had 5 surgical excisions and 7 other procedures that were needed due to my HS. It feels like a privilege to no longer have days where I have lost the mobility of a limb, the ability to walk, to face the public, not having to hide my pain, to only have moments of honesty about this disease in private and with myself. I still can't believe that I have a medical team that I trust and that is compassionate, knowledgeable, and understanding of this disease. I can't believe that I'm here with well-managed and controlled HS because it took decades to get here. 10 years with minor symptoms, 8 years from major onset to diagnosis, and then 10 more years trying to find effective treatments, and finally landing with a team who was determined enough to get me there. The first time that I had what we now know to be an HS flare, I was misdiagnosed. I had an incision and drainage under anesthesia, and at the follow-up, I asked my doctor what caused this abscess to happen and how I could prevent it from happening again. He told me that it was because of poor hygiene and that if I wanted to prevent this from happening again, I needed to take better care of myself. He suggested showering twice a day and told me not to scratch as much. Those words would haunt me for years to come. I walked out of
So this is unfortunately still very common. So I like to just also start off by debunking some myths. HS is not an infection. It is not due to a hygiene problem. Weight loss cannot cure HS, and smoking cessation doesn't stop it, although some patients may do better with weight loss and smoking. It is certainly not a cure to this genetic autoinflammatory condition. The pathogenesis of HS is thought to be initially starting with follicular plugging. Patients are at increased risk with genetic predisposition. We recently did a GWAS study finding some genetic susceptibility genes. Smoking, obesity are risk factors. And we know that there are differences in the microbiome within the hair follicle and the skin of these patients that that is referred to as microbial dysbiosis, which we'll get to in a moment. there is a buildup of pressure within these hair follicles, and the hair follicle is also a little bit weaker than those that don't have HS, and it spills into the dermis with a massive responding inflammatory infiltrate filled with neutrophils. And then this can lead, due to several issues due to the continued inflammation and issues with healing, you end up with these chronic persistent tunnels that then have their own inflammatory component and have a circle of inflammation. Okay, and we're seeing that there is what we call microbial dysbiosis. In fact, those with HS have lower levels of all bacteria. As I said before, this is not an infection, but we do see kind of abnormal levels of normal bacteria, specifically anaerobic bacteria, and the highest amount with a relative overabundance of these gram-negative anaerobic bacteria such as Porphyromonas peptinophilus and the Prevotella species. And these do increase with increasing severity. Interestingly, we're also seeing this dysbiosis in the gut. Those with HS have differences in their microbiome in the gut compared to those that do not have HS. And there's also taxonomic differences with a relative abundance of several bacteria such as Ruminococcus navis and Clostridioides ramosum, which we see an increased in those with inflammatory bowel disease, and also deficiencies of several species as well. So interestingly, those patients that respond to adalimumab have gut changes in their short-chain fatty acids, which are produced by bacteria, as well as changes in their microbiome that look much more like healthy gut. We know that from inflammatory bowel disease literature that those that respond to biologics such as adalimumab have differences in their microbiome. So we may have some microbiota gut microbiomes that are biomarkers for response to these medications. We also have one paper looking at atopic dermatitis that demonstrated that fecal microbial transplant improved the symptoms and findings of atopic dermatitis with lower SCORADs, which are measures of activity of atopic dermatitis. So due to all this, working with Dr. Koritz's group, we are trying a capsule microbiota transplant therapy, or MTT, for HS, which we're super excited about. We've already enrolled 5 patients. This is placebo-controlled, and we're doing doing a antibiotic or placebo for 1 week, and then doing microbiota MTT versus placebo for 3 weeks, the first being 2 capsules and for 1 week, and then 1 capsule for 2 weeks. So a full 3 weeks of treatment with full evaluation of blood, skin, and gut, evaluating HS at 6 weeks and 12 weeks, as well as looking at the microbiome in the skin and the gut. So the study's goals really are to see, is MTT effective in an early small study? Also we'll be one of the first to look at whether changing gut microbiota will change skin microbiome, as well as starting to investigate how does MTT affect changes in blood metabolites. So it's a very exciting study. Again, we've already enrolled 5 patients, so I'm hoping to have some more updates for you soon. So in summary, hidradenitis suppurativa is a relatively common autoinflammatory skin condition with devastating effects on quality of life with limited treatment options. HS pathogenesis involves a skin and gut microbial dysbiosis that may be a driver of pathogenesis and disease, and research is underway to evaluate whether MTT will be an effective therapy for HS, which we're really excited about. And I will say that early, we've had a few patients finish, and it is looking very exciting. And we're also hoping to understand how changing the gut microbiome can both affect the skin microbiome and understand the effects on skin metabolites. I want to give a big shout out to everybody that we're working with. The microbiotic, the HS Foundation, who's funding the study, Dr. Alexander Koritz, Amanda Cabbage, and the University of Minnesota Microbiota Therapeutics Program. And we have an incredible HS team. We have Gretchen Bellafoyle, who I have her picture here because she really is, you know, on the ground running the study. Armina's Wallander working with her. Christopher Staley, Cyrus Johansus, which you've heard from, and Byron Vaughn are all instrumental in making this work. And Athena Giribolini, who you heard from, she is a patient advocate. She is also the head of Hope for HS and on the HS Foundation board. So it was very nice of her to be able to record something to allow us to hear a little bit about her story. Thank you so much, and I wanted to give some time for questions.
Thank you so much, Dr. Goldfarb, for sharing your work. Gosh, it is just incredible to see the potential here and the ways that it can impact patients and their recovery. We do have an opportunity for Q&A, and so if you have a question and haven't asked it yet, please feel free to enter it into the Q&A bar. We do have a question here to start us off. One question is, could lymphedema be a misdiagnosis of HS?
We see lymphedema, mostly groin and buttock lymphedema in HS. So it depends, but we do see that. And so the inflammation does result in scarring, probably of the deeper lymphatics in some of those areas. And some patients have really problems with lymphedema. Whether I haven't seen a lot of patients that just have lymphedema that are misdiagnosed, but I do see a lot of patients with secondary lymphedema.
Mm-hmm. Thank you. Additional question is, you shared, many patients with HS do take biologic medications. Will patients who are enrolled in the trial still be taking those, or is that something that is a disqualifier for the trial?
In this early study, we allowed patients to be on biologics. We are checking. There is some thoughts that, and like I said, the microbiome may affect response to therapy. It may also play a role in the metabolizing of the medication. So I am trying to get levels of the TNF inhibitors and biologics at baseline. And so afterwards, we'll recheck to see, does it increase as well. But in this study, we are allowing even those on biologics who have active HS still.
Thank you. Thank you so much. Additional question is, are there any indications that FMT could help other skin conditions as well?
Well, that was one of the, what led us to do this is we know that HS, or we suspect HS is driven by a microbial dysbiosis. And we know another condition, atopic dermatitis, also has dysbiosis of skin and gut. And so we saw that in a very small study that MTT did improve SCORADs, or disease activity, in those with atopic dermatitis, which led us to do it in this population as well. But I think we're going to be seeing a lot more studies doing this. I think it's very exciting. I think there's a very limited understanding of the skin-gut connections. And so this study is also starting to look at understanding those connections. And patients are always interested in asking about it.
Well, thank you. We really look forward to hearing more about the trial, particularly with how the MTT transplants impact both patients' gut and skin microbial compositions, and how that can impact patient outcomes and treatment. So thank you so much for your work.
Thank you.
And thank you for joining us.
Thank you.
Thank you.